Alzheimer's disease is often associated with 7 modifiable risk factors: diabetes, high blood pressure, high cholesterol, obesity, smoking, depression, low education level, and head injury. Let's go in detail with each one of those. For diabetes, having a type 2 diabetes in midlife increases chances of having dementia, Alzheimer's disease, vascular dementia, and cognitive impairment. Type 2 diabetic patients are twice as likely to develop dementia compared to those without diabetes. Having a high blood pressure in midlife increases chances of having dementia compared to those with normal blood pressure. High blood pressure affects the heart, the arteries, and blood circulation, so it increases the risk of developing Alzheimer's disease, particularly vascular dementia. Evidence showed that risk of Alzheimer's disease if blood pressure is treated with the physical activity and proper diet along with medications. Diagnosis of high cholesterol level in midlife increases chances of having Alzheimer's later in life. Treating cholesterol levels with statin drugs lowers the risk of developing Alzheimer's and dementia. Treating high cholesterol is important for both heart and brain health. It is also a high risk factor for high blood pressure and diabetes. Lack of physical activity increases risk for many health problems like cardiovascular, diabetes, respiratory, etc. Risk for developing Alzheimer's is higher with diagnosis of obesity in midlife. Smoking has been known to cause many health problems such as diabetes, cardiovascular disease, etc. But there is evidence that smokers are at 45% higher risk of developing Alzheimer's disease. They're also at higher risk of developing vascular dementia, but not enough evidence has been gathered so far. Quitting smoking helps reduce the chance of getting Alzheimer's. The exact relationship between depression and Alzheimer's is still not very clear, but it is believed that depression is an early sign of having dementia or Alzheimer's later in life. Although direct correlation between depression and Alzheimer's is still under studies. Speculations is that cortisol levels is elevated during depression, which has degenerative action on the hippocampus, a site that is responsive for learning new things and short-term memory. Another speculation is that depression contributes to chronic inflammation that damages blood vessels and prevents blood flow to the brain, which leads to deterioration of nerves. Lower education levels is directly linked with higher chances of having Alzheimer's later in life, but exact correlation is still yet to be determined. According to some of the statistics, patients with higher education level had to develop Alzheimer's later in their life, like in their 70s and 80s, and patients with lower education levels develop Alzheimer's as early as in their 60s. Having a history of traumatic head injury has been linked to the increased risk of developing Alzheimer's. Following an injury, the brain has increased amount of beta-amyloid protein. This protein is responsible for senile plaque found in Alzheimer's patients.